And now it's my great pleasure to introduce Glen Tullman, who was just referenced, and Jonah Comstock.
Well, following Jonathan, he said really nice things.
Yeah, so Glen, I understand you're in the printing press smuggling business.
Well, I think his description of actually addressing consumers and meeting them where they are, I think was an apt description. It's very hard to go into the hospital and try to fix it there. And so we decided to meet consumers where they were, which is wherever they are, and put them back in charge. And I think that was a bit of a revolutionary idea, revolutionary concept and we were able to do it. So it's a good step forward.
Of course, the trick is to do that, but still not have a D2C business model, right? Because no one's been able to make those work in healthcare.
That's right. I think that, healthcare is so complex, and it's one of the challenges, one of the things that we wanted to do, and the reason that I decided to move out to Silicon Valley was because Silicon Valley is really good at consumer-first businesses, but those generally require that you interact directly with the consumer. And in healthcare, there's different people who regulate the care, who pay for the care, and that's all kind of a mishmash. And so it's been a challenge for Silicon Valley to understand how to navigate the environment of payers and health services companies and PBMs and delivery systems. And all of those organizations have their own set of objectives that don't necessarily correspond with what's best for the health consumer, or what some people call the patient. And so we wanted to go at them. The easiest way to do that was to start with people who are paying for the care, and that was self-insured employers. And what's really kind of fascinating is if you look at what's happened, self-insured employers have gotten to a point where, in a sense, they're saying, we'll try anything. And that was a good point for us. But if you look at, some of the new ventures, if you look at what JP Morgan Chase and Berkshire Hathaway and Amazon did, essentially what they said is we can no longer trust the existing ecosystem to deliver better care at lower cost, and we don't think that they have the same objectives that we do. Our objectives are no longer aligned. And that's not untrue, which is, at the end of the day, saying to a hospital, if you do a great job in the hospital, every bed is empty, the reality is that that's not good for a hospital, but it is good for society. And hospitals aren't going away. We just need to use them more efficiently.
Yeah, and they can't think of themselves as a building that should be as full as possible, right? And I think some of the hospitals here are starting to think of themselves in different ways, maybe not even as a building at all, right? As a sort of service extender into the community.
That's right. I think that, Hemant Taneja from General Catalyst, who's my partner at Livongo and has funded some of the great ventures out there, his whole idea is, what happens is one stage of society is you centralize things, and then you decentralize, right? And so what we're doing is unbundling. So, it used to be that the biggest building was the church and the only people who could read, and that's where all the knowledge was. And then the printing press, to use Jonathan's example, comes along, and all of a sudden everything gets democratized. Well, that used to be the same way. What's the other big building in the community? It's the hospital. Now it's the biggest building and probably the biggest employer, and that's where all the knowledge was. Except that with the internet and with a whole variety of services, we're now saying you can spread that out, and somebody who spends all day learning on the internet every day about a particular subject can probably be smarter than a GP who has to know about 100 things. It's not because the GP isn't incredibly smart, it's because she or he can't spend all day as a specialist on one area. So we're starting to see that spread. The other thing that's happened is, consumers, we used to call them patients, but they aren't patient anymore. So they want healthcare to feel like everything else in their experience. And so, we have a concept at our venture firm called the Informed Connected Health Consumer. And the idea behind that is to say, we invest in things that make people smarter, more informed, that make them more connected. And that's not connected to the internet, it's the internet connected to them. So remote patient monitoring, focusing on health and not health care.
Right.
And then last but not least, treating them not as patients, because it turns out we don't treat patients very well, but treating them as consumers. And so the whole idea behind Livongo was, how do we empower people who have chronic conditions to live better and healthier lives? How do we put not diabetics, we don't call people by their disease name, how do we take people, they're people who happen to have a chronic condition, and how do we put them back in charge? And that was kind of revolutionary, because people said, well, those are the people with the issue. They need help. No, they don't. They need information. They need tools. They can do a fine job. We just have to trust them. We have to give them back control. And then we have a whole ecosystem that can help them. But they know best. And nobody else knows as well as they know what's going to help them at that moment. And particularly where you have people who have multiple chronic conditions. You know, with all of the spend that we've had, and all the technology, and all the devices, and all the breakthrough drugs, what's the experience been for people, particularly with chronic conditions? It's become more confusing, more complex, and more costly. Healthcare is not good. That's how what most people think about it. And so we've made all of this investment, and we haven't been successful. So what we have to think of it as, healthcare, like everything else, is an experience. And if you think of, I like to think of the 4 C's. And so the 4 C's are, the first one was content. And Google came along, and they changed the whole access to content. And that was the first C. And they made it easier and available whenever you needed it. You didn't have to go to a library. You didn't have to look in an old encyclopedia, if people still know what that is. But it was available to you when you needed it, and you could do that search. And that was the first C. And then Facebook came along, and they organized the second C, community. They made it available so you could catch up with your old high school classmates, even though you probably didn't want to, but you could do that, and you could organize groups and stay in touch. And then the best example was Amazon came along and organized the third C, which was commerce. And so, and each one of those became an enormous company, an enormous part of the economy. And the last C is called care. And that's what we think we're doing, because we're organizing that. And what does that really mean? Well, it means, one, we make it available 24/7. We put the consumer back in charge. We use data science to help people, give them options that are going to fit with them. So, you know, I always said, if Amazon can figure out what books I want to read and do a really good job, a frustratingly good job, because they send me a message and they say, you want to read this book. And I look at it and I say, I do need to read that book. And I buy the book, and I have a huge stack of books. Then I realize I don't even read books anymore, so then I have to go and get the book on tape so I can listen to it at 2x while I'm running. But they get it right. And then Netflix says, you want to watch these movies, and they get it right. So why can't we figure out healthcare in the same way? And I think the big breakthrough of Livongo was investing in data science in a way that no one had really been able to close the loop. Because the beauty of Amazon is they know when they advertise something, when they put it in front of you, whether it works. Did you buy it? Did you watch the movie? Did you buy the book? And for the first time now, we not only can aggregate all of this information, not just from our own devices, but from pharmacy records and payers, and from continuous glucose monitors, and from Fitbits and Apple Watches, and all that information. So we aggregate it, and then we interpret it to say, what does it all mean? But here's the magical piece. Then we apply it. So we deliver it to you right at the moment you need it. And then we see if you use it. And if you use it, we do more of it. And if you don't use it, we say, well, it didn't work. And so we've been able to speed that flywheel up. And now, having the largest database of real-time or near real-time diabetes information in the world, that keeps getting better and better about our predictability. So we can look at a population and say, who is going to have an issue, who's not using their meds right. And now we've extended that on our platform beyond diabetes, because 70% of the people with diabetes have hypertension. They don't want a separate device. They don't want a separate coach. They don't want a separate app. They want one experience. And 70% of those people have a behavioral health issue or weight issue. And so you look at that and you say, how do you create that so you can say to people in a new way, we're just there for you when you need it, you're in charge. And the other thing is we've been able to get some of these really innovative employers to actually understand that if you keep people healthy, it's less expensive. So you have amazing companies like Target, which says to their employees, if you use Livongo, we'll not only make your strips free, we'll eliminate your co-pays, and we'll make your meds free. So wow, what an amazing thing if somebody said, well, I had a condition, I became sick, and then all my care was free because all they wanted to do was help me get healthy. Like, that's the kind of healthcare system we want to build.
And we can build, it almost seems like what you're describing is sort of building value-based care outside of the kind of, like, as you were saying, endlessly complicated world of the healthcare, traditional healthcare system. Because we're saying, you know, you're going to deliver this value to employers, and they're going to pay based on that, right, based on engagement and use. And also, you know, for the individual, I'm going to save money if I manage my health, right?
That's right. And I think that we started with self-insured employers, and then some very innovative payers started to say, well, why are people carving us out and moving their diabetes care or their hypertension care? So they came to us, and we started to work with, you know, folks like that, like, you know, Cambia, Mark Gann's great leader, you know, who said, hey, we ought to be doing this. This is better care. People actually love this. And, you know, our net promoter score is in the 60s, and most payers are, you know, struggling around 0, and 10 is considered great by everybody except the people who have to get the care. And so, you know, we had folks like that, and the Blues, a number of the innovative Blue Cross Blue Shield plans and the like started to jump on board. And then the big PBMs who are very consumer focused, you know, folks like CVS Health and Express Scripts said, we actually get measured, we have to deliver this, so they're now our channel partners, and they're distributing our product. And, you know, and they have, and look, I applaud their vision. You know, if you look at CVS Health, what they've said in buying Aetna is what they've really said is, look, we think 80% of all healthcare can be delivered outside the 4 walls of the hospital and outside the purview of a physician. And so part of what they're doing is there's a CVS or a Walgreens or some kind of care center within 2 or 3 miles of virtually all of America. And that's more convenient for people. And if you can use that and you can use telehealth, you start to see the pieces of what will be our future healthcare system. And there's this wonderful quote that says, the future is here, it's just not evenly distributed. So we have everything we need today to build a healthcare system that is consumer first, that is incredibly effective and efficient. We have it all today. And now the last piece is, how do you turn that into an experience that people can actually tolerate and use? So telehealth works in most cases. My son recently called me, and he said, I just had an amazing healthcare experience. So I said, well, what happened? He said, well, it was 10:30 at night. I thought I had a sinus infection. And I tried this thing called Doctors on Demand. Said it like, you know, I had never heard of that. Really? Tell me about it. So he said, it was amazing. I called up. I got, you know, there was a doctor on the computer. She told me exactly what to do. It was amazing. And then she told me where I could go and get, you know, the meds. And it was a 24-hour pharmacy. And it was amazing. And so I said, well, did you go through your health plan? Because they pay for that. He said, no, I would never go through my health plan. It was only like $49. And so, you know, for him, his time, his value, 10:30 at night, and he just thought that was the unbelievable, that was the best experience. And I think we're going to see more and more of that, of people starting to drive what they expect. And it will be driven first and foremost by large self-insured employers, but very quickly, innovative plans, innovative PBMs, and I think even the government will start to follow, because people have run out of not only the energy and the money, but just the patience they have with people saying, this year we're going to give you another program that's not going to work. And people have started to say, look, we can do better. We've seen it in every other industry.
So we dived right into this, and I'm really glad we did, because I wanted to talk about Livongo and healthcare. But I'm sure there are people screaming, there's 5 minutes left and they haven't said the word IPO yet, so the abbreviation IPO. So let's talk a little bit about the journey you've been on for the last year.
Sure. Well, look, I think in today's world, an IPO is a few things. One, it's a branding event. So we deal with some of the largest organizations in the world. We have at Livongo about 20%, or just over 20% of the Fortune 500 now using, growing very rapidly. And they would like to know from a transparency standpoint that if they're going to make these big bets on Livongo, that we're a well-run company, that we have the assets and the resources that we need to continue to grow with them.
And that you have that efficacy data, right? That you're
That's right.
Delivering what you're promising.
Exactly. And so all of that, one, being public gives you that. It's a way for people to look at that, to understand that. Second, in terms of raising capital, from that perspective and doing acquisitions, it gives you a currency, so all that's good. But what you need if you're going to be public is you need a predictable business model. And we're fortunate that Livongo is kind of a magical business. In my last business, at the end of a quarter, every quarter we were sweating to say, can we make the sales? This is a SaaS-based recurring revenue model, so we have 93% member retention, which is crazy, 93%. So that's of people who start using Livongo, who don't leave the company they're working for. If they leave, they can't keep using it right now. But if they stay at the company, 93% keep using it, and 96% client retention. And so from that standpoint, and it's a monthly subscription-based service. Now, the one thing I'd say is it's per participant per month. So we don't charge people. It's not the old model. It's not the model that says pay us even if they don't use it. So if people stop using it, we're on the hook, which we should be. We need to, people always talk about what incentives do you give, and we give almost no incentives. We do say there's no more copays, there's unlimited strips, but on diabetes and similar kinds of things in our behavioral health products or the like. But at the end of the day, what we said is nobody has to convince you to use, Google or to convince you to use any of your services or to use your phone. Like, you use it because it's valuable. And so
it's better than the old way, right?
It's better than the old way. It's valuable. And so we wanted to build services that actually people want to use. So there's nobody's forced to use our service. It's all opt-in, and they can stop. And when they stop, we stop getting paid. We have a period of time where we can try to convince them to stay on it. But after that, they don't pay. Their employer doesn't pay. And there's 3 reasons. One, Net Promoter Score. We measure that. We focus on our members every day, incessantly, about making sure our members are well taken care of. 2, and you mentioned this, clinical efficacy. So you have to not only have data, but it has to be sustainable data and provable data. And we've had that. We've had hundreds of companies look at it. We've had Mercer and Towers look at it. We've had academic studies done to demonstrate that we can actually move the needle. And last but not least, you actually do have to save money. And so, but we think you can do that by operating efficiently. And we've been able to prove that over multiple years. And that's the big 3 that on any business we look at, we say, can we prove that across those 3 businesses? And the one other thing I'd say is now we're getting into the fully insured business. And the challenge there is you need 3 years of data. So people often talk about, there's a bunch of folks out there, competitors, and they say, well, we're going to be just like Livongo, we're going to do this, but you actually need 3 years of data to actually work with the big plans. And they want real data, and it has to be at scale. So you need millions of pieces of data, and you need hundreds of thousands of people who've used it for a long period of time. And it takes a while to get there. It took us 5 years.
So that's a limiter especially for new entrants.
That's right. And you have, they fall into a whole, there's kind of a whole cadre of people who are going to be would-be competitors. But it's a big market. We will eventually have competitors, there's no question. And we welcome them because it's if you think about it, just in diabetes, 32 million people, growing 500,000 people a year. And we have a few 100,000 people today. So we're not even managing to keep up with the growth. We'll fix that problem, but we aren't today in our reported numbers doing that. So that's the opportunity.
Well, I think that's a good note to end on. I wish we had more time. I'm sure I've
Great.
got more questions, but
Well,
thanks
thank
so
you.
much for joining us.
Thanks very much. Thanks, everyone.